All right. Welcome to our noon little event. This is Karen Litos.
Hi.
And we are going to be talking about all things sex, libido, vaginas, toys. It's going to be a good lunch break for y'all. So I met Karen at a conference and just happened to sit next to the best partner ever. And we start talking, and I just, in our frustrations about healthcare system and, women don't have any good care. And she says, yeah, I am actually kind of an expert in menopause and have this whole course on it. And I was like, yes, I picked the right seat. So we had 2 days of, chatting, connecting in between presentations that we were somewhat paying attention to and somewhat not. So Karen, tell me a little bit about your background so everybody knows who we have the pleasure of speaking with.
Okay, so I've been a physical therapist for 20 years, second career. I've been a lot of other things too. And I've been in women's health for about 10 years. So I've been active in the APTA, and I teach courses in pregnancy and all that. But a few years ago, a friend and I, another great PT named Karen Snowden, and I realized that, gee, she hit about 40 and nobody talks about it, right? I mean, all of a sudden you start noticing changes.
Well,
and
let's be clear, your fertility is not your goal, so you're useless.
Yeah, right. And oh, you had a baby, just forget about it. It's normal. You had a baby. And I think, okay, this is not normal. So we started joining the North American Menopause Society. We started immersing ourselves, and our goal was to train people like Cristin so they can go and spread the word that this is not normal. You can have healthy life after menopause and during the menopause transition. So that's my goal. I teach a two-day continuing education course for healthcare providers. And that's where I'm at. So I'm still in clinical practice like Cristin, and I see women in Lansing, Michigan area.
And there's very few providers that really are educated in this.
The reason that you guys all get frustrated is that it's not taught in most medical schools. So you can have really good physicians, but they don't know a darn thing about what happens to women's bodies in menopause. Women's health has only been around since the 90s, and they still don't know so much. So really, when you get somebody like Cristin, she's a gem. There's only about 200 of us in the country that really have strong background as physical therapists in the hormonal changes and what happens and what you can do to maximize your health and quality of life through and beyond the transition of menopause.
Yeah, and I think what led me to understand everything better is because that was a good chunk of patients. It was, they would come in with symptoms and oh, lo and behold, 45, I don't know, stuff started changing. Or how long has this been happening? About a couple years. How's your cycles? Yeah, they're a little funky. Interesting. So it all was something bigger than the symptom that they were coming to me for or had eventually found me for. There was like a list of stuff.
Bigger.
Yeah.
Much bigger. And even the things that they're feeling aren't really half of it of what's going on internally and what their risks are long-term without intervention. So that's why we now screen everybody. You guys come in our clinics, you get the full
screen,
man.
Yeah, and so there is so much to talk about, but what we are going to talk about today is we're just going to get right onto it, and we're going to talk about libido and vaginas, because I have heard it's not usually something that people come into the clinic for, but it's something we talk about and ask after, and it ends up being an issue many times. I would say I also have like friends texting me like, why also, FYI, why don't I care about sex anymore? Please tell me.
Honestly, and sometimes I tell my patients I should have pee, poop, and sex on my business card, because that's really, they'll say, oh my God, I've never talked to anyone about this stuff. And then it's like
talk about it all.
Pandora's box, right?
It's
It's
so relieving. It's just like, oh, can I just talk to to somebody and without like
right.
judgment or without it being weird? Yeah, let's go.
So normal. In fact, it's so normal that anywhere between just low libido, I mean, that there's like 4 domains of sexual dysfunctions, and almost 50% of women have one of them, and they're all interconnected, and that starts in your 40s, ladies.
Yeah.
So there's so many reasons for that, and those domains are like, arousal or response, or
So does that translate to I don't care, I can't orgasm?
I don't care. Okay, arousal is I care, but I can't get aroused. Response means I can't orgasm. And then there's the couples pause. So it's the partner related issues.
I'm like,
and if you think about it, if you don't have a desire, that would be low libido. It's also called hypoactive sexual desire disorder, HSDD. So if you have a low libido, it could be related to the fact that you can't get aroused, you can't have an orgasm, or you maybe have some partner issues that may or may not be physical. They could be mental issues too, and social issues. So,
yeah. So what is happening? What's the main thing happening in our bodies that make that happen?
In our bodies, what happens is as the estrogen starts to decline, all right, that's related to other types of things. It's not all just estrogen or testosterone. About 1 in 10 women really do have low testosterone levels, and that obviously can impact, because that is related to arousal and response, that can relate to low libido. And there are treatments for that. But estrogen is also important, and as estrogen cycle starts slowing down and stopping, testosterone still is released from the ovaries, ladies. Most women do not have low testosterone. That is not the sole reason. Testosterone stays pretty steady for most of us, and in fact, the adrenal glands kick in even more, and aldosterone, that's an androgen that can turn to either estrogen or testosterone. So it's not always that problem, but sometimes what happens is those hormones start getting out of whack. So then it can cause maybe less insulin sensitivity. So then maybe you're starting to gain weight. Maybe you're starting to feel bad. Maybe your thyroid is off. Those thyroid hormones are really important for maintaining metabolism and feeling good. So you can start getting a hormone imbalances that just make you feel bad. And then if you're eating wrong on top of it, because let's face it, most of us in our 40s are working, we have kids, we're running back and forth, we're trying to, a lot of times we might have significant others that we're also trying to keep happy, and we have sometimes aging parents. We have a lot on our plates. It's one of your busiest times of life. So you get tired, and then you're not necessarily eating as well. And then you start gaining weight, and then you don't feel good because you don't fit in your clothes anymore. So this is vicious cycle.
Yeah.
One feeds on the other, and then you start getting depressed. And
this sounds awesome. This sounds really great, really great.
It's preventable. 80% of these things are modifiable risk factors.
80%, you think?
80%. You can't change aging. You can't change that the ovaries are going to shut down, but there's a lot of ways to manage hormonal balance and some of these other factors, even weight gain and other things like that, through modifiable risk factors in terms of keeping yourself healthy with diet and exercise and certain medications that can be really helpful. So that's one of the reasons that happens internally. Here's the other thing that happens. When estrogen goes down, that starts to affect the vulva. Vulva's on the outside, those muscles, those pelvic floor muscles on the outside. The vagina's inside, right? That's the tube and what goes out.
The vagina is the tube.
The vagina is the tube. The outside part is the vulva, and the perineal muscles are around the vulva. Well, what happens with those muscles is they start to get atrophied. Same with the ones inside, because they have lots and lots of estrogen receptors.
And atrophy means they go
Good
away and
point.
shrivel.
They shrivel up. They start to shrivel up. And so what happens is you have lots of nerve endings there, and you also have lots of fat in the labia, and there's lots of blood flow. And when you get less blood flow, you get less, the nerve endings can be less sensitive, and you can start to feel like, okay, I just don't feel this anymore. Or the tissue can get so fragile that you start like getting little micro tears when you're having intercourse. That can cause pain. Well, if you're having pain and that goes on, or if you're not having any arousal because you can't feel anything, that also can lead to low libido, right?
So what was once okay doesn't do it anymore.
Yeah, so what do you do about that, right? Okay, so there's this awesome stuff called vaginal estradiol. It's an estrogen cream or a suppository that you can take, or sometimes women both. It's not systemic. It's not like oral birth control. It's not something that's used transdermally. It is applied either directly into, or a ring, a suppository pill that's twice a week, or a cream that is applied directly to the vaginal area. It's very localized, and that can actually reverse vaginal atrophy.
So you just made your vagina a little younger.
You made your vagina a lot younger.
Right.
And that actually can reverse damages and can actually help restore and maintain it. So if you're starting to get, one of the things that would be really helpful in these situations is to go see someone with, like Cristin or myself, for pelvic floor examination to try and get to the root of, okay, is there something physical going on here where you may benefit from something that actually helps in terms of a cream or something like that, where you may benefit from going to see a doctor and asking if maybe this is a therapy that might help you.
And what I know we all find as pelvic floor therapists is that often women come later after it's been a problem for a long time. And then what your muscles start to do is guard and protect. And then we're treating those muscles before we can even get to the origin. And now there's all of these psychological issues that it's been painful for years. So as soon as you start to notice anything's a problem, do something about it.
That's exactly right, because that can be another cause is, you start getting pain, then your muscles will shorten up, and then you do need physical therapy, because we can help you with that too, along with some of these other things that might be helpful, and actually downtrain that response. Pain is a protective mechanism. So like if you see something scary on TV, your body tightens up, right? Yeah. So if it hurts to have intercourse, your body's going to tighten up, and we can actually help you retrain the brain and actually help those muscles start to restore normal length and not do that automatic response before. Another thing that's very common is sometimes you'll feel like this feeling of hitting inside the vagina when you're having intercourse. And that can be because the cervix can descend a little bit normally, especially if you've had a lot of babies. And that would be, sometimes it's within the normal realms, and honestly, sometimes it can be just resolved with changes in position. Sometimes a pessary, which is a support kind of thing that you can get from a physician, might be helpful. They even make things, something called O-nut, which are these nice little silicone rings that your partner can put on, that so you don't go quite as deep, and yet it's still comfortable for the partner as well if you have a male partner. So that actually, those are things that physical therapists can give you, pelvic floor physical therapists can give you great help and ideas of figuring out what might work best for you.
I think it's also just so empowering because so many women have not been empowered in their bodies for so long. So when things start to happen, and they're different and it's not desired, I think we've been also conditioned to just sort of shut it down and think, sucks to be a woman, sucks to have these issues, like too bad, so sad, like keep moving on. And to go to someone and have it explained and say, oh yeah, I know what that is, here's what you do, like people are amazed that that is a possibility. It's like we please
Changes
people
so
too easy
quickly.
because they've been given such crap in the medical system.
Well, they just don't know. I
Yeah.
mean, even most OB-GYNs, they're baby doctors. They don't, there's very few around that really are up to date on these kind of things. They may have the basics down, but they don't really understand the whole big picture of everything that's going on so many levels. In terms of another thing that can happen, okay, so a lot of people think sometimes it's a matter of, you know, I mean, I've actually had patients come in who have never orgasmed. So of course they don't have any desire. They don't even know how to orgasm. And now they're getting older and they're starting to have less sensitivity too, right? Which the estrogen can help if they're getting some atrophy. But some of it too is a lot of people think the clitoris is this little tiny dot right here.
That's all. It's just a dot.
This is your clitoris, folks. It's huge. It is freaking huge. And those two, this part right here, the glands and the crus, these four things are filled with blood vessels and nerve endings, tons and tons and tons of them. And that's where we get that sexual response to make those muscles contract, and that's how you orgasm. Yes, there's certain G spots that they say that you can orgasm, but actually the literature has actually shown that even if you have deeper orgasms, you're still stimulating the clitoris, and it's not this end point. That's highly sensitive. It's all in through here. So sometimes when you're getting that decreased response, it's because this is inside those muscles or that surrounding tissue right there, and that can be stimulated. How?
How can one stimulate this? Do you have any suggestions?
Oh my gosh. You know what? Vibrators used to be medical devices. They were invented for medical reasons. They're classified as sex toys because they don't have to go through FDA approval, but they're hugely helpful because if you think about it, stimulation increases blood flow. So this is good for people who don't have partners. This is good for people with partners who have decreased sensation. And when they're using those, they may want to concentrate more on the side instead of right up near the top. The key with vibrators are they come in all different types and shapes and sizes, and Cristin can provide you good resources of where you can go. You have to be careful where you get them, right?
Yeah.
Because
there's a lot of junk.
There's a lot of junk. If you go on Amazon and you just see something cheap, it could be made in China, which might be okay, might be not. FDA approved labs are in China. However, if it's not reliably sourced, a lot of times they're made out of materials that are not safe for your vagina, and you don't want chemicals in your vagina. Yeah. So Cristin has lists of reliable sources, and things to look at are, you know, what is good for you. I happen to like the flexible, you know, silicone things. I recommend a lot. They're smaller. This one has like 20 different vibration modes, and it's fairly reasonably priced. They can run anywhere from $10 to $20 up to $300. Yeah. So
you know what's interesting is I use vibration a lot in other parts of the body for healing purposes. And so exactly. When anybody has a nerve issue, it could be in their hand, their neck, their leg, their vagina, then I use vibration, and I'll often ask people, hey, do you have a vibrator? And sometimes it's for vaginal stimulation, but sometimes it's to put on their shoulder to stimulate those areas because it's about nerve sensitivity.
It is. It improves sensitivity. That's why you want one that's actually has a lot of different settings and things like that. Yeah. It's helpful. I like soft and flexible. Some women, you know, you might want to start out with something small and see if it, you know, reasonably priced, and then you might want to, you know, just play around with it a while until you find just what works for you. They come in steel or silicone. The only thing is I recommend when you're using to use a lot of water-based lubricant with
yeah talk to us a little bit about lubricants.
Yeah, so lubricants, water-based lubricants will not break down silicone. They won't break down condoms. If you're using an oil-based lubricant, you know, even like olive oil or something like that, that can break down silicone, and that can break down condoms. And you don't want those chemicals in your vagina. Once again, there are really good sources of organic lubricants. I mean, Cristin can help you with that as
Yeah,
well.
I'll post a list of them. We have there are
We all have our favorites.
yeah.
But definitely, you know, water-based, you can't go wrong because it's compatible with everything, and people don't use enough of it. When you're using a lubricant, especially if you're getting any dryness or anything like that, you can even get that breastfeeding, ladies. So you can imagine you're in your 40s, you're breastfeeding, you're getting hormonal changes, you're really prone to dryness.
Yeah, I mean, you basically have a taste of menopause.
Right.
Postpartum.
And you're getting hormone changes anyway. That starts at 30. So by 40s, you usually start feeling some things. And so then it's really important to have those nice, thick lubricants if you're feeling any dryness at all. And that'll make intercourse a lot more comfortable for you. They say 2 tablespoons. So women don't use enough of it. Be generous with it.
Generous with your lube, and sometimes even inside the vagina, not just on partner, toy, around, inside. And so, lube it up.
That's the one thing with the different kinds of estradiol that you can do too. I mean, sometimes if you're really, really dry, you might need to ask your doctor if you can have the cream and the suppository, because the cream is a nice supplement for the vulvar tissue, but it's really messy if you have to squish it way up inside using one of those little
applicator.
So it's a positive, and they make little pills that'll get the vaginal tissue and just kind of melt inside. And those are really easy, and they're less messy. But sometimes it's good to have that cream, especially if most of it's around the outside. So so hopefully, you know, just based on this short conversation, there's so much to be done if you have a symptom. And so if sex is even starting to get uncomfortable, explore, come to a pelvic floor therapist first. Right, they can make really good recommendations for you.
And we can kind of tease out what we think is sort of a skin issue, a hormonal issue. And, you know, what I love to do is help people put a team together. And, you know, this should be your team for this part of your life. And, you know, this is one little aspect that needs a team. There's a lot more that we could talk about in your body.
That's so true, because, you know, I have a team too. I have a functional medicine physician that I work with, gynecologist and OBs that I work with, and even family doctors. So, yeah, there's so many people that you can get that can help build the team, because you really still need the diet and the exercise, because that's going to manage stress levels. That also can contribute. It's going to help manage weight and that pro-inflammatory response you get, where you get that bloating and things like that. Diet and exercise are really important. For that, speaking to the personal trainer. There are another couple kinds of hormones that can be helpful for some women. So the FDA has approved DHEA vaginally as well, which is, it also mostly in the vagina will turn into estrogen, but it also has it can turn into testosterone. It's one of those precursors. It's an androgen that can turn into either one. It'll mostly turn into estrogen. It might turn into a little testosterone. There's evidence that it has a mild effect on libido. I mean, like maybe 1 extra episode a month, but still. And then there's also testosterone for that 1 in 10 who truly does have low testosterone levels. There are now testosterone therapies that are at normal physiologic levels. Those have to be monitored by a physician pretty regularly, because if you get outside that zone, you can start having issues with it. But
so who would you recommend? Who would be the provider that to look at hormones, and we could have an hour conversation about hormones and testing and that sort of thing? Who would you say to try first?
I'm a big fan of finding actual physicians who are functional medicine physicians, rather than chiropractors who've taken functional medicine training, because I think that sometimes they look at tests too much rather than looking at the whole medical they look at the whole thing. I just like that extra medical background because it's very different in chiropractors than physicians, if you can find someone like that. Other than that, there are really good practitioners. Testosterone therapy can be ordered by Menopause. North American Menopause Society has practitioners who are listed who are specifically menopause trained, and that website is menopause.org. So you can go there and see if there's somebody in your area, whether it's a nurse practitioner or a physician, somebody.
And I
like
think
that.
that would be the best place to start, because I think that you're at least guaranteed a different conversation. And I would say if you went to somebody who's your family provider or your gynecologist and you intuitively don't think that you were supported or had the answers, keep looking. That's like it's the kind of the Wild West out there for women's health. So you really have to, there's people out there. It just takes a little while to find them. Sometimes.
The North American Menopause Society is the leading experts in the country, and they're physicians, nurses, counselors. I belong to it. They're just different people that really look at the research, put out really good information, and they have a list of providers. So anyone in your state, and sometimes you don't even have to have people in your state. Sometimes you can get online consults with people who are out of state who at least give you some good guidance.
Yeah, great. That is very, very helpful. And if you want more information, I'm going to be doing a menopause sort of full body assessment next Wednesday.
Yay!
And I know there's quite a few people already signed up for it. So we're going to hit on the highlights of hormones, body, your heart, your teeth, a little bit more on sex, like just the high points of who should be on your team and why you should care and what the hell is happening in your body from a deeper perspective. So join us, and I will put everything that Karen has talked about. I'll kind of put it in the notes wherever you can see this video, so that you have those links. And I thank you from the bottom of my heart. I wish we were actually together at a conference. I miss that deeply.
Yeah, virtual hug.
I know, virtual hug. Thank you so much, and please get in touch with me if anybody has any more questions. I'd be happy to answer them. Have a great day.
Thank you for having me. That was fun.
I know.
Okay, take care, Cristin.
Thanks so much for watching that video. Please hit the subscribe button if you'd like to see more of those videos and keep learning on how to read your body. Have a great day.